Hey everyone, in this lesson we're going to talk about the protozoal disease known as African trypanosomiasis. So to begin, what is African trypanosomiasis? Well, African trypanosomiasis is a disease caused by an infection with a parasitic protozoa from the genus Trypanosoma. And here's an image of those Trypanosoma parasitic protozoa. African trypanosomiasis is also known as African sleeping sickness, and we'll talk about why that is later on in the lesson. The Trypanosoma protozoa that causes African trypanosomiasis is transmitted by the tsetse flies of the genus Glossina, and here's an image of a tsetse fly. Now, it is estimated that about 100,000 deaths occur each year due to African trypanosomiasis. And the disease, African trypanosomiasis, is distributed in the sub-Saharan African region. Here's a map of the area where African trypanosomiasis occurs, and interestingly, this is also the distribution of the tsetse fly. So the tsetse fly, its natural distribution is in the same area, and it also transmits the disease African trypanosomiasis in this area. So what are some of the Trypanosoma species that cause African trypanosomiasis? Well, one of the species that causes African trypanosomiasis is Trypanosoma brutii rhodesians. And Trypanosoma brutii rhodesians causes an acute illness, and it is more located in East Africa, so in the eastern sub-Saharan African region. The second species that causes African trypanosomiasis is Trypanosoma brutii gambiens. And this species causes a more chronic condition. So as opposed to the brutii rhodesians, which causes an acute and rapid illness, brutii gambiens causes a more chronic and slowly progressing illness. And an example of this is the meningoencephalitic stage. It takes about 250 days to occur, and we'll talk a bit more about these stages of the illness a little later. The Trypanosoma brutii gambien species occurs in the west and central part of the sub-Saharan African region, so as opposed to the brutii rhodesians, which occurs in the East African region. Now, there are other species of Trypanosoma protozoa that cause African trypanosomiasis as well. Some of them include Trypanosoma brutii brutii, brutii lewisi, brutii congolens, and brutii evansi. So these also can cause African trypanosomiasis, but the major two are the most important species that cause African trypanosomiasis is the Trypanosoma brutii rhodesians and Trypanosoma brutii gambiens. So we're going to talk about those two more specifically in this lesson. Now here's the life cycle of the Trypanosoma species that causes African trypanosomiasis. Now we mentioned that these Trypanosoma species are carried within this tsetse fly. Now the tsetse fly, as we mentioned before, is located within the sub-Saharan African region, and it is commonly found in warm and shaded areas, and the tsetse fly lives for about 1 to 6 months. When a tsetse fly encounters a person, that tsetse fly can take a blood meal or bite that person. And when they bite the person, they actually inject metacyclic trypamastogotes. Once these metacyclic trypamastogotes are inside the person, they can transform into bloodstream trypamastogotes. And then they can be carried to other sites in the body. So these trypamastogotes can then enter into other sites such as the lymphatic system, into lymph, and they can also even enter into spinal fluid. Once they are within these different areas of the body, the trypamastogotes can continually multiply by binary fission. And they can start causing a lot of the symptoms we'll discuss in the next couple of slides. Now, when trypamastogotes are inside the blood, if a tsetse fly encounters the person that is infected, the actual tsetse fly can actually take a blood meal and actually itself become infected with the bloodstream trypamastogotes. So the bloodstream trypamastogotes can be ingested by the tsetse fly from an infected person, and then the tsetse fly can be a carrier of these trypamastogotes that can infect other individuals later. So once the tsetse fly ingests bloodstream trypanosomiasis from an infected individual, these bloodstream trypanosomiasis inside the tsetse fly can then transform into procyclic trypanosomiasis within the tsetse fly's midgut. And then these procyclic trypanosomiasis can multiply again by binary fission. The procyclic trypanosomiasis eventually leave the midgut of the tsetse fly and then transform into epimastogotes. The epimastogotes can then enter into the salivary gland of the tsetse fly and multiply there. And then inside the salivary gland, they can then transform into the metacyclic trypanosomiasis. And those metacyclic trypanosomiasis can then infect another person when that tsetse fly bites someone else. So that is the entire cycle of the trypanosoma species that causes African trypanosomiasis. So if an individual is infected with a trypanosoma species, that individual does have some innate immunity through the protein apolipoprotein L1. And apolipoprotein L1 is in fact trypanolytic. So what happens is the trypanosoma species can engulf the apolipoprotein L1 through an endosome, but the apolipoprotein L1 actually causes a destruction of the trypanosoma. And with humoral immunity, there is a major variant surface glycoprotein, or VSG, on the trypanosoma organism. But what is interesting and what is important for the pathogenesis of trypanosomiasis is that the trypanosoma can actually periodically switch their VSG, or their variant surface glycoprotein, so they can make changes to that protein. So when the body of an infected individual makes antibodies to a specific variant surface glycoprotein, that trypanosoma can change or switch their VSG so that those antibodies are no longer effective. So they can continually avoid or attempt to avoid the infected person's humoral immunity response. And we call this antigenic variation. And this leads to nonspecific activation of humoral immunity. So as the body continually attempts to target that variant surface glycoprotein, the trypanosoma can switch the variant surface glycoprotein and evade the infected person's humoral immunity response. Now, if an individual is infected with trypanosoma species that causes African trypanosomiasis, what are some of the symptoms? Well, the symptoms are actually divided into two stages: stage 1, early infection, and stage 2, late infection. So in an early infection, there are specific symptoms that occur. One of them that is most important is where the tsetse fly actually bit into the person, and it can actually cause what is called a trypanosomal chancre. And here is a trypanosomal chancre. This is typically, in most cases, the first sign that can be detected. It usually occurs 1 week after a bite from the tsetse fly. It's well circumscribed. It's described as rubbery, and it's considered painful, and it is indurated. Now, there's also a rash that can occur as well, a trypanosomal rash, and the rash typically occurs within 6 to 8 weeks after the initial infection. It is transient, urticarial, and it's macular. And the lymphatic system can be involved as well in the early stages of infection. So the trypanosoma travel to regional lymphatics. So once they are taken up into the body, they can travel into the lymphatic system in regional areas, and it can cause lymphadenitis, so an inflammation of the lymph nodes. With the Trypanosoma brucei gambians, the lymph nodes in the posterior cervical area, the posterior cervical lymph nodes, are the ones that are typically affected. And they lead to a painless and enlarged posterior cervical lymph nodes. And this is called Winterbottom sign. So here's an image of a Winterbottom sign. You can see here this individual has these enlarged lymph nodes in certain areas, along their back and in their neck. Now, the other species, Trypanosoma brucei rhodesians, has a different distribution with regards to the lymphatic system. It typically has less lymphadenopathy, so it doesn't affect the lymph nodes as much as Trypanosoma brucei gambians, but when it does, it affects the submandibular, axillary, and inguinal lymph nodes the most, as opposed to brucei gambians, which actually causes the posterior cervical lymph nodes to be affected. So now that we know what happens in the early stages of African trypanosomiasis infection, what happens in the later stages? Well, in stage 2, or the late infection of African trypanosomiasis, this is considered stage 2 or late infection once the central nervous system is involved. And once the central nervous system is involved, if left untreated, the mortality rate is 100%. The involvement of the CNS can be determined if there is an elevated white blood cell count within the cerebrospinal fluid, and it usually is about at least 5 cells or 5 white blood cells per microliter. With an infection of Trypanosoma brucei gambians, for stage 2 infection, during an earlier exposure, it can lead to progressive diffuse meningoencephalitis. It can lead to meningeal inflammatory infiltrates, and it can lead to widespread focal white matter demyelination. And with all of those effects, some of the symptoms involved due to an infection with Trypanosoma brucei gambians include headaches, difficulty concentrating, completing complex tasks, personality changes, psychosis, and tremors and ataxia. Other symptoms of a infection with Trypanosoma brucei gambians include alterations in circadian rhythm, leading to daytime somnolence or excessive daytime sleepiness. And now this is very important, as this is the reason why African trypanosomiasis is also referred to as African sleeping sickness, because of the alterations in circadian rhythm. And if left untreated, Trypanosoma brucei gambians infections eventually lead to a comatose state in patients. Now, an infection with Trypanosoma brucei rhodesians has similar symptoms to Trypanosoma brucei gambians, but has a more rapid onset, and it typically can take only weeks. So, Trypanosoma brucei rhodesians infection is acute and severe and febrile, and it can also have symptoms of myocarditis and pericarditis. So how do we actually diagnose African trypanosomiasis? And once we diagnose, how do we actually treat it? Well, diagnosis of African trypanosomiasis can be accomplished by a blood smear to see if we actually can see the Trypanosoma protozoa. And a blood smear for diagnosing African trypanosomiasis is more important with Trypanosoma brucei rhodesians because we can actually see them actually in the bloodstream or in the blood. And it can be positive in earlier stages, as Trypanosoma brucei rhodesians can rapidly infect and rapidly proliferate in a patient. And to detect on a blood smear, typically we need to see about at least 5,000 protozoa per ml of blood. Now, with tissue aspirate, this can be important, as if the Trypanosoma species infects the lymph nodes, we can actually take an aspirate of the lymph node and look at it under a microscope, and then we might be able to see the Trypanosoma species that way. And this is important with Trypanosoma brucei gambians, as the species typically involves the lymph nodes. So a tissue aspirate can be important for diagnosing patients with an infection with Trypanosoma brucei gambians. As well, cerebrospinal fluid, so a spinal tap, is important to see if we can detect any trypanosoma within the spinal fluid, or if we can see any white blood cells. So we may be able to see pleocytosis within the cerebrospinal fluid. Serology is also important to detect, to see if we can find any antibodies to any of these Trypanosoma species. And PCR is also a method to diagnose patients with infections. One of the most important things before we start treatment is to check the patient's cerebrospinal fluid. That's one of the first things we want to do, because that will determine if it's an early stage or stage 1 infection, or if it's later stage or stage 2 infection. And that's important because depending on the stage, if it's early or late, that will change what treatment we use. So if the patient has been found to be infected with Trypanosoma brucei gambians, and it's been determined that it's an early infection, then we can use pentamidine. And if we don't use pentamidine, we could use suramin. And if it's been found that it is a late infection of Trypanosoma brucei gambians, we would have to use eflornithine plus or minus nifurtimox. So the reason that we change the medication, the reason that we use eflornithine as opposed to pentamidine, is because pentamidine does not cross the blood-brain barrier well. Eflornithine does. So in order to treat a CNS-involved infection of trypanosomiasis, we'd have to use something that can cross the blood-brain barrier. So eflornithine would be the one we'd use. Now, if it was found that the patient was infected with Trypanosoma brucei rhodesians, and it was determined that it was an early infection, that there was no CNS involvement, we could use suramin as the treatment. But if it was found to be a late infection, CNS was involved, and it was a Trypanosoma brucei rhodesians infection, we'd have to use melarsoprol. And you might be wondering, okay, why can't we use eflornithine in these cases? Well, it appears that eflornithine has no effect on treating Trypanosoma brucei rhodesians, so we have to use melarsoprol. So that's the reason why it's important to also figure out what species we're dealing with as well. And melarsoprol can be 10 daily injections can be used to treat, and that's been shown to be effective. Anyways, guys, that was a lesson on African trypanosomiasis. I hope you found this video helpful. If you did, please like and subscribe for more videos like this one. And as always, thank you so much for watching, and I'll see you next time.